Good afternoon. Allegheny County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on the COVID-19 pandemic. We continue to see better results, and Dr. Bogan will certainly fill us in on her weekly report. We also see more and more people getting vaccinated. In the month of March, we vaccinated approximately 388,000 shots in arms. With 2 days to go in April, we're over 412,000 shots in arms. And we're a little over 65% of the adult population with at least one shot. So it's almost 2/3 of the population. And now we've got to make sure that last 1/3 also gets protected. To date, over the last 14 months, we've had almost 600,000 of our fellow Americans succumb to this deadly disease. Over 26,000 of our fellow Pennsylvanians as well, and almost 1,900 of our friends and family members here in Allegheny County who have also died due to COVID-19. We know these vaccines work. We know these vaccines are 100% effective when it comes to the fatality rate. So it is really to get back to normal, to where we can feel free to take our masks off and to feel free to get together again. It really is the vaccine that gives us that hope and that freedom and that lifeline that we all need. So Dr. Bogan and her team have really worked extremely hard to get out to all of our disadvantaged and left behind communities. And they've done really a good job. And we're going to continue to do that and talk about how to get to folks who are homebound, our homeless population, our college students, our young people, our high school students. Clinics are now open all over the county. You could find very easily. And again, Dr. Bogan will go through all that. So the fact is, now they're available. Let's get our friends, our family members, everybody vaccinated so that we can get back to normal and keep everybody safe and literally run that death rate all the way down. So let me turn it over now to Dr. Bogan to give her weekly update. Dr. Bogan?
Thank you, County Executive. Good afternoon, and thank you for joining us for our weekly COVID-19 briefing. I have several items to discuss today, including the new CDC recommendations on outdoor mask wearing, our continued efforts to vaccinate for vaccinations for the homebound and other harder to reach communities, and the significance of April in terms of health. But first, the numbers. While I still caution that we remain in a fourth wave, I think we are on the other side of the peak of this wave. Cases encouragingly continue to decline. Last week, daily case counts dropped from over 400 to about 350 cases per day, and I'm pleased to report that over the past week, cases have dropped even further to about 275 cases a day. Positivity rates also continue to decline. We're headed in the right direction. Hospitalizations are decreasing ever so slightly. However, like other locations across the U.S., those younger than 65 are making up more of those hospitalized for COVID-19. In terms of vaccination rates, we continue to make progress with nearly 90% of those 65 and older partially or fully vaccinated, and 61% of those aged 50 to 64 fully or partially vaccinated. Next, I'd like to discuss countywide efforts to vaccinate harder to reach populations. On Monday, Governor Wolf called for intensified efforts in vaccinating homebound Pennsylvanians. This is something I've discussed at these briefings for the past few weeks. I'll reiterate that I agree with Governor Wolf that all barriers must be removed so that anyone who wants to be vaccinated can do so easily. That's really been our goal all along, and the increase in supply now makes this achievable. There have to be different outreach efforts for different groups. ACHD efforts to vaccinate the homebound began early when we went into senior living facilities and administered doses on site, sometimes in their apartments. There has been vaccination events at nearly every senior living facility in the county that desired one. It was really a great team effort, including the health department, federally qualified health centers, pharmacies, healthcare providers, and others. We held events at senior centers, and we gave doses to EMS services, including in Plum, for first responders to bring vaccines directly to homebound residents. And we continue to provide more options to vaccinate this at-risk population. Insurance companies, including Highmark and UPMC health plans, are helping to arrange home vaccination for those who are truly homebound. If you have either of these insurances, you can call the appropriate customer service number to get assistance. And the customer service number is typically found on your insurance card, or you can find it online. If you don't have one of these health insurances, you can call the 211 line to be added to our list of people awaiting outreach. Before the pause, the Janssen vaccine was allocated to local healthcare providers with the expressed instructions that they would go to hard-to-reach communities. However, now that the vaccine was given, these efforts are resuming. In short, we have the vaccine supply to get everyone 16 and older vaccinated, but we have largely reached those eager to get the vaccine and or easy to reach. So we must continue to focus on bringing the vaccines to the hesitant or harder to reach, and we will work diligently to do so. Now I'd like to discuss the new federal recommendations regarding outdoor mask wearing. Yesterday, the CDC announced that fully vaccinated people can visit with other fully vaccinated people indoors without wearing masks or physically distancing. And they can participate in outdoor activities and recreation without a mask, except in certain crowded settings and venues. The CDC also loosened travel restrictions and need for testing and quarantine after exposure for fully vaccinated people. And the details for this can be found on the CDC website. This is really encouraging news and illustrates the importance of getting vaccinated. It moves us closer to normalcy, but we need everyone to get vaccinated if we want complete normalcy. I'd also like to remind you that you should continue to socially distance outside when others are around. After all, not everyone around you is fully vaccinated. We still have lots of cases here, and it's a simple act of respect for others to look out for their health, even if you are protected. And please don't forget that indoor mask wearing mandates have not changed. Vaccinated or not, if you are indoors with other people at work or in businesses, or with unvaccinated people, you must wear a well-fitted mask and socially distance. Now, shifting gears a bit. April is almost over, but before the month ends, I want to ensure that everyone is aware that April is National Minority Health Month. This designation aims to raise awareness about the ongoing health disparities affecting racial and ethnic minority populations. This year's theme for National Minority Health Month is Vaccine Ready. The focus is to empower communities to get the facts about COVID-19 vaccines, share accurate vaccine information, participate in clinical trials, get vaccinated, and practice COVID-19 safety measures. Here in Allegheny County and much of the U.S., there are long-standing health disparities across racial and ethnic lines in many areas. For example, infant mortality, diabetes, hypertension, life expectancy, and of course, COVID-19 cases, hospitalizations, and deaths. Healthcare providers and vaccine providers, including the health department, are working to address health disparities related to COVID by removing barriers to testing, treatment, and vaccination, and taking vaccine into every community. However, to address long-standing racial and ethnic health disparities, everyone can and must do their part, first by acknowledging that disparities exist, and then considering how our individual and institutional behaviors and policies impact disparities. And finally, how to work to address those behaviors and policies. It is not easy, but it is essential. The goal is health equity, which the Robert Wood Johnson Foundation defines as increasing opportunities for everyone to live the healthiest life possible, no matter who we are, where we live, or how much money we make. Finally, on an administrative note, starting tomorrow, the daily updates will be released at noon, an hour later than we currently release it. This is to give our busy staff some cushion on days when the state database comes in a bit late. With that, I want to thank you for joining us again today on this warm and sunny summer-like day. Please get vaccinated and help your friends, your colleagues, your family members, your neighbors get vaccinated. And please be safe and be kind. Thank you.
This first question is from WESA. The last 3 or 4 days of case numbers were under 300, and most of the indicators for Allegheny County on the state's early warning dashboard are also in decline. Do you see this as the result of the COVID vaccine, or are there other factors at play?
So thanks for that question. I do think it's a lot due to vaccines, but not entirely due to vaccines. So weather may be playing a role in this. The fact that people are outdoors, that windows are open, circulation is better, that could be playing a role. It could also be due some to natural immunity that we have. If you look at our case numbers now, close to 100,000 people, or a little over 90, I can't remember the exact number, 96,000 or so, have been confirmed cases in our county. But then that represents certainly an underestimate because especially early on, we didn't test everybody for COVID-19. So we know there were people who had cases, but we didn't test. And there were a lot of asymptomatic people who didn't have any symptoms who would never have gotten tested. So that's an underestimate. So I think, yes, huge effect of vaccines, but probably some other things at play as well.
We have 2 questions that are similar from both print and WESA. How many breakthrough cases of COVID have there been among vaccinated Allegheny County residents? And can you tell us how many of these people may have been hospitalized or died?
Sure. And again, these data have limitations. Again, people may not be getting tested, et cetera. But from the data we do have, so far we are aware of about 170 cases of breakthrough cases post-vaccine in our community. We are aware of 5 hospitalizations that we think are related to COVID-19 post-vaccine, and 2 breakthrough deaths, both in older adults with underlying health conditions.
This next question is from KDKA. Now that the state has adopted the updated masking recommendations set by the CDC, what challenges do you anticipate regarding enforcement, and what is your message to people who are now considering not wearing one in some settings, even if they haven't been fully vaccinated?
Well, I think I addressed some of that in my comments, which is that I encourage people, again, when you're in crowds, please wear your mask, be respectful of other people, and really take personal responsibility, not just for yourself, but to make sure you're protecting other people in that situation. In terms of enforcement, we don't enforce and go out and enforce mask mandates on the streets, but we do have some role to play in food establishments and things like that, and we'll continue to work with those businesses and food establishments to give guidance and support and education. But really, I ask everyone to think about your fellow citizens and colleagues when you're out and about. I know that, for instance, today I sent a reminder to all the health department staff to continue to wear their masks indoors and to follow the indoor mask guidance carefully so that we protect one another.
This next question is from WTAE. Do you have any reaction to PPG Paints Arena proposing a vaccinated section for events? They sent a release earlier today with this excerpt. Today, the Penguins organization petitioned the state government and the Pennsylvania Department of Health to consider the option of creating vaccinated sections for our fans at PPG Paints Arena. Do you support that type of move for venues and sports teams?
Yes, I think it's it's the right thing to do, and I applaud the Penguins for doing that. I think now that we're getting, again, 2/3 of the population with at least one shot in arm and a significant amount of people who have been vaccinated, those folks can feel safe if they're together. And they don't need to be 6 feet apart. They don't need to be wearing their masks. If everybody that's been vaccinated in an area can be together. And I would encourage all of our sports teams, all of our venues, theaters, the opera, the symphony, the playhouse, etc., to go ahead and think about the same thing. I know we're considering that, and probably will do that with our summer concert series at Hartwood Acres and at South Park, where we will create, and they don't start for another month or so till early June. And by that point, everybody will have had access to vaccines. Everybody will have had the ability to get one, as they've been now over 2 weeks where all people are eligible to get them. So yeah, I do applaud the Penguins for doing that, and I do hope that other venues consider the same thing.
This next question is from WESA. Can you tell us when in-person press conferences might resume at the county?
We're probably looking at in late May, early June. I mean, at that point, we will again have been 6 weeks since the mid-April, to which even if you get the 4-week between the first and second shot, and then the 2-week period until you're fully covered, that 6-week period would open that up. So we're probably looking at that period of time for lots of things, not just for the in-person press conferences.
This next question is from Kitty K. Free at-home COVID test kits are being distributed to residents of Pitt County, North Carolina, as part of a federal pilot program where public health officials are examining the impact of regular testing access. It's being called the future of fighting and tracking COVID. Does the county have any plans on providing this type of testing, and if so, how would that work?
So at this time, we don't have any plans like that. Wait and see what happens in North Carolina and the effectiveness of it. We have been, by the way, doing lots of testing in our county efforts. You know, we've had the curative testing in many locations. We've taken it to lots of locations. We've been distributing the Binax Now cards, the rapid antigen tests, to many sites around the county. So we do have really broad-based testing available, but home testing is a different area. And again, we don't have any immediate plans for that at this time.
And this final question from WESA, are there any updates on additional vaccine clinics that are smaller, such as the clinic being held at Bethlehem Baptist Church in McKeesport?
Yeah. Thanks. As I mentioned last week, you know, we are shifting our focus from large events to smaller, more focused events, working with community partners. And as those events become available, we'll certainly let you know. We are, for example, going to anticipate that we'll be closing down our Castle Shannon site for first doses in the coming weeks, again, as an example of shifting our staff to be available for other types of events. So we'll keep you posted as we make those changes.
And that was the final question. If there's any closing remarks.
Thank you, Dr. Bogan. And it you know, again appears as cases are going down, hospitalizations and fatality rates continue to go down. We certainly want to encourage, again, our young population who have only been eligible very recently, because while young people are certainly, you know, less at risk than folks that are in an older population, the fact is it can be spread. And the spread to our grandparents, our parents, our aunts and uncles, neighbors, teachers, you know, all the folks, coaches that we come in contact with, you're protecting those. And you know, I mentioned some of those early numbers earlier on in the talk. We've lost more people to this pandemic than we lost during World War II, World War I, Korean War, Vietnam War, Gulf War, Iraq, or Afghanistan. This is a war that we're hopefully getting on the other side of. And there is no question that the vaccines are working. Nationally, we were over 3,000 deaths a day just a little over a month ago. That's 9/11 every day of fatalities that we were having in this country. We are now under 700 deaths a day, and hopefully that number will continue to go down. That happened when the vaccine started getting into people's arms in January and February, and now obviously the last couple of months. And we can see those same numbers here in Allegheny County. It looks like for April, this will be the first time since November we've been under 100 deaths for the month. And we obviously hope that number continues to go down, drive it down to 0. But it's a lot of work, and we're going to continue to do so. I'm so proud of the fact that almost 2/3 of the folks in Allegheny County, our adult population, has 1 shot in arms. That's one of the highest in the country, and something we should all be proud of. And I get questions all the time by folks around the country. How does that happen? It happens because we believe our medical experts, people like Dr. Bogan, people like our friends at the University of Pittsburgh Medical Center, at UPMC and AHN, and Pitt Medical School. We've got a great tradition and a great history going back to Dr. Salk and Dr. Starzl and all the medical institutions that have kept us so safe and kept us healthy for so many years. So let's get those vaccines, get them in people's arms. Let's get everybody protected. As Dr. Bogan said, we can get back to some level of normalcy, and we'll see you again next week.